going to talk about non-controversial stem cells and the rationale for their clinical use. And I use the word non-controversial because all of the sources that we use are really not controversial. They're not. There's nobody being harmed in the process of acquiring the raw materials for the stem cells that we use. I'm going to give you a little bit of history of how we got started, where we got started. I'm going to talk a little bit about the types of stem cells. I'm going to talk a little bit about stem cells decrease with age, how your own stem cells can help, how younger stem cells may also possibly help, and I'm going to talk about safety issues of these non-controversial sources of stem cells. So our history, we actually opened in Costa Rica in 2006. I actually went down there in 2004. It took me 2 years to get open, to get through all the regulatory processes in Costa Rica, and we opened in June of 2006. Shortly thereafter, I met Dr. Jorge Paz Rodriguez, our next speaker, and our medical director in Panama. And the Panamanian government actually gave us quite a few incentives to create a location there, and we were invited to go into the City of Knowledge, which is they have a technology park there, and it's a zone for basically incubating companies. There are actually pharmaceutical companies in there as well, so we were invited to go there. So we expanded into Panama in 2007, and ultimately we consolidated everything in Panama. So there are two companies. There's Medistem Panama, which licensed the technology from Medistem USA, which is a publicly traded company in San Diego, and then there's the Stem Cell Institute, which is actually where all the treatments are done. The Medistem is a laboratory, and these are some pictures from the lab. The Stem Cell Institute, we have 4 doctors in-house. We utilize many doctors from the community. Obviously, we use plastic surgeons quite a bit. We use hematologists to get bone marrow, and we use specialists, orthopedic specialists for treatment. So we use a lot of doctors, but we have 4 physicians in-house. And as I mentioned, Dr. Paz is our medical director, and he actually trained in New York, and he practiced in Texas for a number of years before. He's Panamanian, but he and his wife Lisi, and Lisi's here too, and thank you to Lisi. She's been helping out. Anyway, they decided to go back to Panama and set up their practice, there. And so, a lot of people ask why are we different from any other place that does stem cells? And one of the main reasons that we're different is that we're fully transparent. And that's the last thing on the slide, but that's what we are first and foremost. We invite anybody from anywhere, anytime, to come and see our place. And we've had scientists and doctors from many universities in the United States and elsewhere. They've come and seen our place, and we collaborate with a lot of universities. We've published with the University of San Diego, University of California, San Diego, University of Utah. Meet Patel's one of the top regenerative medicine stem cell guys on the planet. University of Western Ontario. We work a lot with Indiana University as well. And we publish our results, we publish our protocols. So there are no secrets about what we do. There's no secret sauce or anything like that. We put in our publications, we have 29 publications just related to stem cells out of our facilities. So we're very open about what we do and transparent. We license this technology from Medistem in the U.S. One of the big things we do is quality control, and I've heard, stories from other places where, they really don't even characterize the cells. Well, we have 3 flow cytometers. We have more flow cytometers than the rest of Central America together. So we characterize these cells. We have really top-notch quality control. External laboratories make sure there's no infectious disease. They test for sterility, for any kind of impurities. And one of the main things that I think differentiates is we won't take a patient unless we have really strong scientific rationale and a belief that we can significantly help them. So out of 100 people who apply, we'll accept 15. 15% of the patients that apply to us actually come as patients. We have a medical review board. They meet weekly. They go over every case and define whether there is sufficient scientific rationale to actually do the treatment. And the protocols are customized for every patient and for every condition. So there are several different kinds of stem cells. The controversial ones are embryonic and fetal, and we don't work with any of those. We only work with postnatal cells from the umbilical cord and the placenta. And we only work out of this list of adult stem cells with stem cells from the fat and the bone marrow. Recently, they discovered MSCs in the teeth, and we were the first to describe in 2007 stem cells, mesenchymal stem cells in the menstrual blood. So the stem cells that are used at Stem Cell Institute are either come from the fat tissue of the patient, or from the bone marrow of the patient, or they come from the umbilical cord blood, and that's where we get the CD34 cells, which have certain functions. And the tissue of the umbilical cord, it's called Wharton's jelly, the matrix of that is digested, and we get mesenchymal stem cells from those as well. So the major classes are these blood-forming cells, which are the CD34s. And if you think bone marrow transplant, the majority of use for those cells historically has been for bone marrow transplant. For example, a patient has cancer, and in an attempt to destroy all the cancer cells, the bone marrow is collateral damage. And without having a transplant to repopulate the bone marrow, then the patient will die not of the cancer, but of the lack of having blood-forming cells and no immune system. So when you hear about bone marrow transplants, that's typically what you're hearing about. Then you have the tissue repair cell, or the mesenchymal stem cells, and these home to damaged tissue, they're really potent. They can really reduce inflammation, and they're actually very smart. They're very intelligent on their own, because they will sense the amount of inflammation. If there's more inflammation, they'll produce more anti-inflammatory molecules. So they kind of have they have this sensing mechanism. So they can actually repair themselves, and they produce these trophic factors that help the rest of the tissue. And there's a study going on right now that it isn't published yet, but I know the scientists that are doing it in Texas, and they've taken these cells and they're doing wounds on the skin of animals, and they're putting the cells there. And originally we thought, well, these cells, they go in and they actually do the repair. Well, what they're finding is 90% of the effect is the factors that they're secreting into the tissue are exciting the tissue to repair itself. So 90% of the effect is really not cellular, it's the molecules that they're producing. So, and of course, they're very good at modulating the immune system. So these MSCs, where are they? Where are they in your body? Well, they're everywhere, because they're found around every blood vessel. And in order your whole body is full of blood vessels, and these cells surround the blood vessels. So they're everywhere in everybody's body. Has anybody seen the body exhibit? It's pretty cool, isn't it? Well, this is one of the displays, and where they took they pumped something into the bloodstream to basically rubberize the vasculature, and so you're looking at the vasculature, and then they dissolved everything else away, so the bones and the muscle and everything's gone except for the vasculature. And so this is an example. It's everywhere in your body. The arms and legs are cut off, and the head, but everywhere in your body you have blood vessels, and everywhere you find a blood vessel, you have MSCs. So they're everywhere in your body. So Dr. Smith talked about age, and it's pretty depressing, but MSCs decline with age. And this is actually from the bone marrow, and this is a slide from Dr. Arnold Kaplan, who's actually the first person to ever describe the MSC, okay? And he knows more about MSCs than we'll ever know. He's probably forgotten more than we'll ever know. But he looked at newborn bone marrow, and then teenagers, 30, 50, and 80 years old. And you can see the number of stem cells goes way down in the bone marrow as we age. And there's this huge drop from newborn to teen. And when you think about it, there are a lot fewer in the bone marrow, but where did they go? Did they all die? Well, they didn't. He started from this cuddly, lovable 7-pound mass, and then it has to grow. The baby has to grow into in my case, 120 20 pounds. No. Half of that. Into a fully grown human in your teen years, you're fully developing. Well, those cells have to support the vasculature and the tissue that you've gone from 7 pounds to 150, let's say. So that they were disseminated throughout the body. So I'm going to actually talk about two cases today, and they're both related to, they're both immune diseases, okay? And they're both diseases which the patient was treated using their own fat, using the stem cells from their own fat, okay? And so the highest utility we found for the MSCs from the fat are for immune diseases. So I'm going to talk about those. And some of the examples are MS and rheumatoid arthritis, osteoarthritis, which actually does have a bit of an immune component to it. And I'm going to present a case of psoriatic arthritis. So this was a few years ago at Northwestern University. Dr. Burt did a study where they gave patients who had multiple sclerosis chemotherapy to knock down their, basically, they harvested, like Dr. Maharaj does, they harvested some of the stem cells and put them away, and then they gave them chemotherapy because MS is a disease of the T cells. And the T cells are found, in the bone marrow. If they could wipe out the bone marrow, basically reset the immune system. And so they did that with patients, and they reset their immune systems, and they didn't do anything to the disease we think of. It's in the brain and the spinal cord. There are lesions in our brain and spinal cord. That's what MS is. They didn't do anything to address that. All they did is they wiped out the immune system that was attacking, and the people got better. So this is the first indication. This is the first study that wiping out, completely obliterating the attacking immune cells would result in clinical recovery. So, I can go through all this, but I just told you what they did. But it does validate the fact that just immune modulation can shut down MS without affecting, the CNS at all. And because they actually did groups of patients, people that were under 5 years and they did people that were longer than 5 years, and the earlier patients, the people who had been diagnosed for a shorter period of time did better. So the rationale for the treatment is that for multiple sclerosis, rheumatoid arthritis, and other immunological diseases, the first thing we have to understand is that MS is not a neurological disease. It's an immunological disease. The immune system is attacking the central nervous system. And in rheumatoid arthritis, it's not a joint disease, it's an immune disease. The immune system is attacking the joints. So the problem is you have these activated, and this is the most science I'm going to have, and it's going to go way down from here. So just bear with me through a couple of slides. But you have activated T cell clones in these diseases, right? And of course, in cases of rheumatoid arthritis, these clones are producing armies of cells that are attacking, right? In the case of MS, they're producing armies of cells that are attacking the central nervous system. So this is the process, and what happens is these activated T cells then start dividing, and they produce this army of cells, ultimately, that these cells that are going to attack the tissue. Well, what MSCs have been shown to do is block right here. So they don't block the activation. The activation goes ahead and continues on, but they block what's called clonal expansion, basically making an army of these cells. So in the fat, in addition, the thing I guess I'm missing a slide here is that the fat is a very rich source of MSCs. And when we originally started treating patients, we were using only from umbilical cord MSCs, and the relative cost to isolate and basically create a number of cells that was effective was cost prohibitive. And then all these data are coming out about fat, and fat is about 30% of the cells are MSCs. So we're like, why don't we just use fat? And I'll talk a little bit about the safety of that later. But in addition to the MSCs that are found in the fat, you also have T regulatory cells, which are active. They're actively immunosuppressive, where the MSCs modulate by blocking clonal expansion. The T regulatory cells are actively immunosuppressive. So we had two people that were from Dallas-Fort Worth area. One was a police officer, the other was a hospital administrator, and they were both down for treatment. And they basically were our first patients. They were the guinea pigs who wanted to undergo this. So they were the first two people that we treated with adipose stem cells. And after the third patient, these two patients just did fantastically well, and then the third patient did fantastically well, so we wrote a paper about it. So in these three cases, basically there was a dramatic improvement in all three cases. There were no side effects other than from the liposuction. And this article was published in collaboration with the University of California, San Diego, where they actually did the radiology and everything. And the first author is Dr. Menya from there. But I think I want to talk about the mini liposuction for a minute, because I get a lot of razzing about this. You know, a liposuction for cosmetic purposes, typically they'll take 3, 4, 5 liters, right? So it's a highly traumatic thing. You're really taking a lot of fat out, whereas we only want about a pound of fat. So it is mini in that sense, but it's a little bit misleading, because even though you're just taking a pound of fat, there's a lot of bruising. And so I want to express that there is a lot of bruising that goes along with it, but it dissipates within a few days. But Holly was razzing me about that last night. You and your mini liposuction. I tell you, there was nothing mini about it. So I'm going to talk about two cases that illustrate the potential of using cells. And Dr. Smith talked about a case of rheumatoid arthritis that responded really well. This is a case of a disease called psoriatic arthritis, which is relatively rare, thankfully, because it is a horrible disease. And it's almost like having the worst case of psoriasis, which is plaques on the skin, and it actually affects the hair and the nails as well, combined with a very severe case of rheumatoid arthritis, which is, you know, red, hot, inflamed joints. It's a horrible, horrible disease. And you probably heard Phil Mickelson, the golfer, one of the best golfers in the world, was recently diagnosed with this. And there are drugs to treat it, but unfortunately, in many cases, they work for a while, but then the body adjusts for them, and then they stop working. And that was the case with this 28-year-old lady who came to see us. And so again, it's an immune system problem. And these aren't pictures of her, but these are photographs of somebody with psoriatic arthritis. And this poor gal, her entire body was covered with these plaques. I mean, there wasn't a spot on her body where she wasn't covered in these plaques. And her fingernails were worse than this. They were split, and and her joints were just red hot. And here's an example of ankles and the toenails with somebody. Like I said, she had lesions all over her skin. Her hair was falling out in clumps. She only had a few clumps left when she came. Her mom, when she described her on the phone, said she looks like a leper. And I don't even know what a leper looks like, but she wouldn't go out. She hadn't gone outside for 2 years because she couldn't face people. All of her joints were red hot, inflamed, painful. She couldn't even use her left arm at all because of pain. It was in a sling. She got a mini liposuction. And approximately 100 million cells were retrieved in her laboratory from the fat. And she was given those 2 doses just in her arm, right? Just sit down, it's anticlimactic. You're sitting there for, 20 minutes and it's over. And then she came back a few days later and got the other shot. Well, we followed up over time. Oh, this is all the stuff we did. But we followed up with her over time. And she said, well, I'm getting better, I'm getting better, I'm getting better. She wound up coming back 10 months later, and she looked like a movie star. I mean, she's a beautiful young lady. She has, full head of blonde hair. All of her fingernails were fine. All her joints, all the red hot thing, no joint had any inflammation in it. She had residual damage to her knees, which happens quite often because there was such a strong immune attack. And she actually came back to get her knees retreated with some of her fat stem cells that we had frozen. But it was we didn't even believe it was her when she walked in because the massive difference. And the only thing she had were 2 small plaques on her chest. And so she could hide those. But obviously, a very dramatic case, completely changed her life, and changed our lives appreciably as well. I am going to just briefly talk about spinal cord injury. It's not the core of my talk, but I'm going to talk about it because we have a patient who's going to talk later. His name is Juan Carlos Murillo, and I wanted to explain what we did treatment-wise for him. So, the problem with spinal cord injury is spinal cord just doesn't like to regenerate. Other tissues can regenerate. You can take 90% of your liver out and it'll regrow a new liver. Spinal cord just doesn't want to do it. So there was a really interesting study where they took, this was done in Taiwan, and there are a lot of other studies that show in animal models that if you implant umbilical cord MSCs, they will home to and they will stimulate the spinal cord to repair itself. But this one did a really fantastic job. The way they did it is they cut the rat spinal cord, and when they do that, the spinal cord will retract about 1 to 2 millimeters, so there's a little gap in there. And this is just a diagram of, and this is the gap, right? The diagram of what they did. And they took human, these are rats, they took human MSCs that they got from umbilical cord, the tissue of the umbilical cord, and they put it in fibrin, which is a natural clotting substance found in your blood. They put it in fibrin, which gels up, and they put it right there at the wound, right there at the cut. And what it did is it stimulated these the spinal cords to regenerate, to regrow. And this is the regrowth. In the control, this is how many neural fibers were found traversing. And then with the stem cell, you can see that there's more than 4 times the fibers going across. And then they use conditioned media. They basically use the soup from the cells as well, and that stimulated somewhat as well. So we started treating spinal cord injury with the rationale that both CD34s, we know that they'll home to the area of damage in the spinal cord if they're given. There are plenty of studies demonstrating that if they're given intrathecally into the spinal column, that they'll migrate to the point of injury and they'll secrete substances there to help promote the tissue to repair itself, number one. There are studies showing MSCs like that will do the same thing. There are also studies showing that when you give these cells intravenously, particularly in somebody who had a traumatic injury, which almost all of these are, then the blood supply feeding the area is diminished, right? So if you give cells intravenously, they'll home to that damaged area where the blood supply isn't getting enough blood to the area surrounding the spinal cord and create new blood vessels called angiogenesis, right? So we treat using both intravenous for creating angiogenesis and intrathecally for stimulating the spinal cord to regenerate itself. So I just want to give some background on the rationale why we do that, because Juan Carlos is going to talk later about his particular journey with stem cells. So I'm going to talk for a few minutes about safety of the fat-derived stem cells and also of umbilical cord stem cells. There are a couple companies now, but the first company to treat using fat-derived stem cells is VetStem. They're located in Poway, California, or Poway. How do you say it? Poway. And I've known Dr. Harmon since, I don't know, for a very long time, and when he first started that company, and we've collaborated, and some of the ideas that we've gotten, they had an animal model of something that's similar to rheumatoid arthritis, but it's not exactly rheumatoid arthritis, and they treat them with the dog with fat-derived stem cells, and they got completely better. Right, so there's cross-pollination between them, but they treated over 8,000 animals, and this slide was made a year ago, so I'm sure it's a lot more than that now. With very few side effects. They treat a lot of horses, a lot of race horses. There's not a horse in the Derby that ran last week, I don't think, that had not received stem cells, either from their fat or from their bone marrow. Because it's legal. They don't, anybody hear about the pitcher? There's a pitcher for New York Yankees that was treated in the Dominican Republic, and it's not quite clear what they did, but last year he was sitting out. He's 37 years old, and he could barely, I don't know, they didn't even play him because he was debilitated, his shoulder and his elbow, and it's unclear exactly what they did, but they talked about bone marrow and fat-derived stem cells that they gave him, and now he's just pitching up a storm. He's faster than he was when he was younger, so it's pretty incredible. So we're doing a retrospective analysis with Indiana University on safety. This is a bit of an old slide, but at the time we had treated a total of 850 patients. More than 300 of those patients had been treated with fat, with their own fat. And at the time we had given over 800 intravenous infusions of their own fat stem cells. And the average cell number is 30 million per shot. So out of those 800 infusions, we've seen pain at the site of the infusion. We've seen coldness in the arm. We've had one case of a venous thrombosis, so blood clot in the vein that it was given in, that resolved within 24 hours. We've had one case of flu-like symptoms that resolved in 24 hours. So all in all, for that many infusions, the side effect rate is pretty low. And hopefully we'll publish that within the next month or so. So umbilical cord, a lot of people freak out about, you're going to use somebody else's cells on me, you know, and it's natural and it's, you know, it's scary. It's the new frontier. So what rationale do you have why they would be safe? Well, we do thousands of transplantations every year for bone marrow, the whole bone marrow thing when somebody has cancer and they do bone marrow transplants to restore, and that's a different subject, okay? But thousands of those are done every year safely. And of course, they have to be matched and they have to be immunosuppressed, and there's a whole lot that goes with that, but those are done. As far back in the 1930s, when we ran out of blood, they started using cord blood, and they gave tens of thousands of units of cord blood as a replacement for blood transfusion, right? If somebody lost, too much blood, then they used the cord blood instead of, donated blood. So there's a long history of that. In the Lancet, there was a study. They showed 128 patients were given cord blood. So it's not even, the stem cells haven't even been isolated, but the stem cells are in there and all the other cells are there. And 128 cases, no adverse effects. Journal, the American College of Surgeons, 413 units of cord blood was given in another study, absolutely no side effects. We've given more than 1,000 injections, and we've had 2 cases of rash reported with no other side effects. So I always look at it, maybe from a 30,000-foot view, but is this a natural process to take cells from one person and put them into another, right? Well, in 2004 in the Lancet, and since then, many papers have been published, but every mother who's carried a child has the stem cells of that child in her bone marrow. Every mother, right? So, and we know that they're genetically distinct. They're at least 50% genetically distinct, and they may or may not be HLA matching, but it doesn't matter. They persist up to 30 years later. So every mom who's carried a baby has stem cells from their baby. And it once was thought that mothers, because of this microchimerism, they call it, where a small amount of stem cells set up shop in mom, that there were increased levels of autoimmune diseases because those cells were creating immune clones that were attacking. And they actually did a prospective trial of sclerosis, and they found that the inverse was true. The stress and the physical and sometimes emotional stress of bearing and raising a child would actually decrease your lifespan. But the inverse is true. This is a study where they followed a bunch of families, and they found that actually you got about 1/3 of a year per kid. Your longevity increased 1/3 of a year per child carried up to 14. And then I think the suicide rate went way up. But anyway, I find that fascinating. I'm going to talk about another case. This is a guy from Texas. His name is Dusty Durrell, and he's Dr. Paz is his hero because he really helped him out. He came down really for osteoarthritis, and he had pretty severe osteoarthritis in his knees, and he had a lot of pain in his hands from osteoarthritis. And he's 76 years old. There's a saying in Russia that goes something like this: if if you wake up and you're out and you're older than 50 and you have no pain, you're dead, right? So I'm over 50. I can attest to this. Anyway, so he was given the mini liposuction, the famous mini liposuction, and they Dr. Paz injected cells into both his knees and also gave him a pretty whopping dose intravenously. And I'm just going to use his own words because these are emails that he sent back. These are follow-up emails that this is what he reported. And this guy was so excited about it, he put together a conference like this at the university, at a college in Corpus Christi, and invited Dr. Paz. He had the mayor there, and it was a big whoop-de-doo. Anyway, he's pretty excited. He was just named the person of the decade for Corpus Christi for his various philanthropic things that he's done. But anyways, he's quite a character. Clicking and soreness in my knees has disappeared. My erectile dysfunction has disappeared. No need for blue pills anymore. My bladder problem of involuntary leakage has resolved. My hair is continuing to turn gray from the original white. My skin is continuing to clear up. The folds of skin on my lower neck have disappeared. My office staff claims I'm more alert and involved than before the treatment. All in all, I feel your procedure has been an outstanding success. So that's Dusty Durrell. And it's just the simple liposuction where a pound of fat is taken, it's taken into the lab, it's digested, the stem cells and the non-fat cells are taken out, and they're given in the arm, and in his case also in the knees. So this brings me, I'm shocked that we are where we are in this country, that we cannot do this here. And we can transplant a liver, we can transplant a lung, a heart and lung, skin, kidneys, pretty much everything but a brain, you can transplant in this country, and it's exempt under the rules. We can do in vitro fertilization. We can create life in the lab and give it back. It's unregulated, or actually it's regulated, but it's allowed basically through the federal regulations. And the FDA has taken the position that the manipulation steps of digesting the fat are too much for anybody other than a large pharmaceutical company to do, and that those cells, your cells that are in your fat, having been isolated in that way, are a new drug. So in order to do that, you need to have a biological license and an investigational new drug license from the FDA to even start your $800 million odyssey towards approval of the treatment. So unfortunately, until things change, and that's why I'm so thankful that Berkeley Bedell's here, and his foundation is working very hard trying to get these regulations changed. There is one of the transplantation regulations has a word in it that says homologous. So it's legal for a plastic surgeon to suck out your fat and digest it and everything else, and then put it back if he intends it to be fat, right? But if his intention is not for it to be fat, it's a new drug. So it's a very fine line, and hopefully through the efforts of Berkeley and other people, it will happen. So in summary, I just want to say that I think adult stem cells seem to be pretty useful for regenerative medicine. We've been seeing really good results. We're really excited about what we're doing, really happy about what we're doing. We love moving forward and discovering new things. Cord blood cells have been used 20 years for bone marrow transplants. Now they're being used for neurological conditions, and you're going to hear about some of those conditions. Fat-derived stem cells, cord and placental cells have been shown to be beneficial with relatively few side effects. And I think these cells should be intensely researched. And I wanted to welcome, I forgot to welcome Bill Courtwright and his group. He owns a company in Panama called BioFit. And what's the company here? Symbio, and some of his group are here, and I wanted to put a shout out to him because he organized several people coming here. Anyway, and I thank you all for coming and sharing our story. Thank you.